when older adults have higher fat mass and less muscle, so the drugs are meant to be metabolized in the muscle, and so older adults can have a drug toxicity issue much easier than a younger person who has more muscle mass, more fluid in their system, and just a body that's digesting things more quickly. So older adults have many reasons that medications are risky. And so some new research that's coming out say that if people go to a chiropractor first, they're less likely to have an adverse event of drugs. They're less likely to die from or become opioid addicted and die. So chiropractic is saving lives quietly in the background.
Hello, I am Celia Sanka, Executive Director of the DiversityCanada Foundation, the organization that brings you GoldenVoices.com, the online portal where seniors gather to focus on issues of importance to seniors. At GoldenVoices.com, you'll find the GoldenYears Fireside Chat series, where we gather with experts and everyday seniors and focus on topics under the theme of living longer and living well. So today we will be speaking about growing older, having the pains that come, the aches and pains that come as we grow older, and an alternative form of care for dealing with those pains, and that is chiropractic care. Is chiropractic care safe for seniors? And what are the best practices in chiropractic care when dealing with older adults? To explore this issue, we will be speaking with Dr. Lisa Killinger. Dr. Killinger is a professor and immediate past chair of diagnosis and radiology at Palmer College of Chiropractic in Davenport, Iowa in the United States. She earned her Doctor of Chiropractic degree from Palmer College, and she is a member of the Foundation for Chiropractic Progress, a not-for-profit organization dedicated to increasing public awareness regarding the value of chiropractic care. Perhaps we can start with the preliminaries and look at chiropractors. Chiropractors have the designation doctor. So what exactly is a chiropractor, and what do these health professionals do?
Chiropractor is a physician-level health professional, and according to the Bureau of Labor in the U.S., chiropractors assess, treat, and care for patients by manipulation of the spine and other parts of the musculoskeletal system.
In Canada as well, chiropractors have the doctor designation too. So that's good. So now we are focusing on seniors, and seniors are a rapidly growing demographic in Canada, in the US, and across the world. So I imagine that your profession is seeing more and more seniors.
Absolutely. Over the past 15 years, and it will continue to go in this trend because of the baby boom that we've moved to now. Closer to a half of our chiropractic practice are people over 50, and then a half of those are over 65. It's expected to keep increasing, and so we see a fair number of people that are older in our practice that are boomers like me. I'm on the very tail edge of the baby boom. And chiropractors treat over 40 million people in North America every year. That's including the U.S. and Canada. It's about, I think it's 35 million in the United States and another 5 million or so in Canada. And just to get an idea what that is like, that's 1 million chiropractic adjustments performed every I want to make sure I'm correct. Every day, yes, 1 million chiropractic adjustments just in the U.S. alone, and then another, maybe 70,000 in Canada. So clearly, the public has certainly warmly embraced a movement towards chiropractic care.
Yes, so not only because of demographic trends, but I want to pick up on what you just said. Chiropractic care has become more and more popular. Not only the numbers are growing, but the decision that people are making. It's a part of alternative care, if I'm not mistaken. And how have both patients and doctors changed in their attitude towards chiropractic care?
Right. Well, I absolutely think that, first of all, that there's a trend in general, and this is seen in the scientific literature as well, that people are moving towards alternative and complementary care more and more. This is a huge trend, and that it's a trend that's moving a shift in money spent on healthcare towards alternative and complementary healthcare, which is why it's being studied. People in traditional medicine may be a little concerned that some of their paycheck is now going to in places like the United States where it's a for-profit system. They're concerned and wondering, what are we doing? What are we missing? But that's just people's preference. They want to do natural things. They understand that they have personal responsibility for their health, and chiropractors have really always been an advocate of that. Now, in the olden days, chiropractors were not favored by medical doctors, and in fact, there was an illegal boycott of chiropractic in the United States, done by the American Medical Association, and then there was a big lawsuit about the time I was in chiropractic college in the 1980s, and it was found that medicine was illegally boycotting and actually discouraging their members, and they would kick a member out of the medical association if they talked to a chiropractor, referred a patient to the chiropractor. But since they were found guilty, that has gone away, and more chiropractors and medical professionals and other health professionals are working together collaboratively. So largely that historical problem was because just a lack of education, lack of information about what chiropractic education was, lack of research at that time. And now, since chiropractic had really stepped up its research in the past 40 years, now there's a great deal of understanding. In fact, the American College of Physicians, in their guidelines, include chiropractic for the care of low back pain. And the American Geriatric Society, specifically to older adults, care of older adults, they've been recommending chiropractic care as part of musculoskeletal care since 1998. So those old battles, we don't have to carry the baggage of our fathers, so to speak. We can move on and get along better for the good of the patient, and I'm really happy about that.
As you mentioned, there have been more studies in the profession, and you were part of a study or a survey of studies that was done recently on best practices for older adults. For those who are on the fence or who have concerns, how safe is chiropractic care for older adults? What did your that study show?
Thank you for asking. Of course, what researcher wouldn't want to talk about the research that they've done? Thank you for that opening. But also, too, I just want to say that a long time ago, one of the first things I did when I was a researcher, as my principal job, was I did a focus group of older adults who had not been to a chiropractor but who have back pain. And we asked them, not me, but a moderator asked them, what is it that keeps you from going to the chiropractor? And the vast majority said that they were worried about getting hurt. Their pain was already difficult for them to manage. They were concerned that chiropractic would make it worse, that they would hurt worse. So I completely understand that that's a concern of older adults especially. And if you've seen maybe old-timey or old-school chiropractic adjustments, they might think, ooh, that doesn't seem for me like it's safe. But there are over 200 techniques in chiropractic, and many of them are tailored specifically for the older adult patient, which we can talk about down the line. But in that article you mentioned, the 2017 Best Practices study, we reviewed all of the safety literature in chiropractic and found that adverse events that are serious, so serious adverse events that would take someone to a doctor or that they would have to get health care for, are so rare under chiropractic care that they're almost immeasurable. It's the best estimates are 1 in a million to 1 in 10 million chiropractic adjustments cause a serious event. That's lower than any immunization. It's lower than anything that we do in our day-to-day lives. It's certainly lower than acetaminophen or taking Tylenol for back pain. Way lower risk than that. So we are a very, very safe profession. In fact, soreness, though, after the chiropractic adjustment, they've studied carefully because that's a concerning adverse event. And even though it's mild and self-limiting, usually a soreness that might last a day, that is, when they studied and really drilled down on that, they found that it was similar, the soreness that you might get after a chiropractic adjustment of some types of adjustments that are more aggressive would be similar to the type of soreness you would get in activities of daily living or mild exercise. So again, it's not something that should keep someone from seeking the care that they need. The safety and benefits would outweigh the risks by far.
No need for someone to be trembling. People tremble when they go to the dentist. They know there's pain behind that door, but that's not the same for when someone goes to the chiropractor.
We're lucky as chiropractors in that people are looking forward to seeing us. We have a positive interaction with patients, and then they look forward to seeing us again next time. So it's a completely different experience than being a dentist. The poor dentists, I feel for them. It's got to not be fun that they know people dread coming to see. And I love dentists, and I just got my teeth cleaned, and I was so happy. I loved it. But we know that that's not something people go, woohoo, I'm going to the dentist today. Yeah. I do want to mention, because safety is an important issue, I want to mention that there's two things that people have been maybe seeing some, scary things. They feel like, oh, maybe chiropractic can cause a stroke, or maybe chiropractic can cause, an artery to dissect. And in all of the studies that they've reviewed with good research methods, they have found that there's no connection between a chiropractic adjustment. Just the forces that we use are not consistent with the damage that would be to cause that sort of injury in, almost in every case in all of the studies that they studied. Also, too, what happens is people that have headaches, that when they're having a stroke, they'll go to see a medical doctor or a chiropractor. And in both cases, we have to be good diagnosticians to make sure that they get the care that they need, not give them a chiropractic adjustment, send them to the hospital. Same with a medical doctor, family physician. They have similar statistics to us of having a patient have a stroke, having a stroke, come in to see them, and missing it. So we were both on a level playing field in this. We just all health professionals need to be good diagnosticians to make sure that if a patient is having a stroke already, that we don't do anything, that we get them right to the emergency room or the emergency hospital center.
So it's very much focused on the patient and understanding what's happening with the patient and being responsive to him or her.
Sure, and just not missing those big things. Yeah.
When we're talking about seniors coming to the chiropractor, what are the most common problems that bring seniors into your office?
Since the beginning of when they've been assessing why do people go to chiropractors, or what are the complaints that bring people to chiropractors, it's always been low back pain is the number one problem. And that's probably smart, because low back pain affects about 4 out of 5 people over their lifetime and is the number one leading cause of disability globally. So it's a huge public health concern, and chiropractors are well suited to care for people with low back pain. And in my humble opinion, and in the opinion of many guidelines, spinal manipulation is the safest intervention and is the most effective, so should be the first stop, should be the first thing that happens. So we have certainly seen a lot of people with low back pain, and second to that is neck pain, and third is headaches. So those are the 3 main things that are in the spine that people come to seek out for chiropractic care for.
So it's not just low back pain. Your chiropractor can help you with headaches and with neck pain. What are some of the other conditions that you can help a senior, you can alleviate the discomfort or pain that a senior may be experiencing?
Well, this is an interesting historical question, because back in the 30s and 40s, chiropractic only cared for the spine. And they didn't really do any manipulation or care of the extremities, the arms and the legs. But, I mean, since the 1970s and 80s, many chiropractic colleges, in fact, I would say most chiropractic colleges, have done training in caring for the shoulders, the knees, the hips, elbows. And so extremity complaints are actually higher among older adults than younger patients that we see. I mean, who doesn't know an older adult with a bad shoulder or a bad knee or a hip that bothers them or something? So it doesn't surprise me one bit that studies on musculoskeletal issues in chiropractic have found that oftentimes we are seeing patients that have a complaint in the extremities, and we care well for those complaints and often help them to avoid surgery or help them to avoid having chronic use of medications. So they may not have to take so much pain medicine, which is never intended. Those pain medicines are never intended for long-term chronic use. They have serious side effects. So what we can do is help patients avoid medication for some of those musculoskeletal extremity complaints. And then beyond that, and those are things that we've all studied, chiropractor for shoulders and for knees and things, and there's a lot of articles about that. But there's fewer articles and there's less big money being spent on research of what chiropractors may help with incidentally. Incidentally, in my practice, I've had patients that came and saw me, and their chief complaint was, well, it was low back pain, or it was neck pain, or it was shoulder, spinal pain of some sort. Then they come shyly to me later and said, you know why I really come and see you regularly? And I say, well, it says right here, low back pain. They said, well, actually, when I come to see you, I don't have constipation, or my hemorrhoids go away, or random things like this. And I shouldn't be surprised, because I know from studying anatomy that there's nerves that go to every organ and every muscle and every part of the body. And when we influence the nerves that come out through the spine, things can happen. And I've seen things that were just nothing short of a miracle, related to asthma, related to, digestive things. And even just adjusting someone yesterday, they said it was 2 days ago, but yesterday they told me the result of that. I adjusted them. They said, everything's hurting. I need to be cared for. I adjust them. And then I got a text that said, I think I just pooped about 7 days worth of poop. Sorry about that, for too much information. But that was what the impact was. And they'd been too shy to say that they had been really struggling with this. Everything was just locked up. And that's what was the impact. And so I didn't go to cure their constipation. I went to help them with their spinal pain. And the side effect of that was that everything started flowing better in their overall system. And so I just can tell you that from everything from that to asthma to patients telling me I don't have to be on as much anxiety medicine, I don't feel as dizzy, I've been more steady on my feet. All of those things are things that chiropractors observe in practice. And again, we don't have a solid foundation of scientific studies to prove efficacy. But I'm just going to listen to my patients and know that I shouldn't be surprised when other things improve while under chiropractic care.
Yes, that the other parts of this body, other part of the system responds to the care under chiropractor. That's pretty interesting. Now, you had mentioned something a while ago, that's a medication. If someone hadn't come to the chiropractor, most likely the person may have been prescribed pain medication. Can we explore that a bit? Tell us why, particularly for seniors, pain medication may not be the best way to go.
And it's very, very true, and thank you, because it's an important question. I think with the audience of older adults, it's important that they know that medication should not be the first thing that they look at. It's a riskier intervention. In this country, about 100,000 people die every year from adverse drug events that are medications taken as prescribed. And just related to Tylenol, I think they have about 3,000 to 3,300 deaths in older adults every year in our country. So it's not that these medications can be taken without any downsides to them. So there are always risks, and a lot of those risks can be digestive, getting an ulcer, getting a bleed that then causes a fall that kills them. So there's complicated. But the even more important things might be that older adults with back pain that's significant will sometimes be prescribed opioids or opiate medication. And opioids have become so popularly prescribed in our country that it's become a leading cause of death. More people die from that than car accidents in the United States. So it's a real problem. And so that's why the guidelines are now saying try something else first. Don't go and get an opioid because that's too dangerous, and the addiction problems and the side effect of respiratory distress in older adults is very significant. And it's also true that most older adults and younger adults, let's say anyone that gets a prescription, they sometimes get the package that the prescription is in. It has maybe the cautions and the big sheet that tells you all of the things that could possibly go awry in little 4-point font so that old people can't read it, like myself. And then we pull that thing off, we throw that away and get to the prescription and take it. So many people don't read that they're not supposed to take alcohol with Tylenol. They're not supposed to use alcohol with Advil or any of the NSAIDs, and they're not supposed to use alcohol with opioids. All three of the pain management strategies that they will get from if they go to a medical doctor first. I'm not criticizing medicine, it's just the only tool they have, the least invasive tool they have. So with alcohol, with those drugs, there's some significant changes that can occur in the metabolism of those drugs that can be fatal for older adults. So a lot of older adults will enjoy a nightcap here and there, or a wine with dinner or something. But with any of those prescriptions or any of those over-the-counter medicines, it's very, very dangerous, particularly in the older adults. The second thing that happens in prescriptions with older adults is they'll be given a muscle relaxant. Like the brand names we have are Flexeril or Scalaxin. It sounds so relaxing, doesn't it? Scalaxin. But if they get this medication, it's actually on the list of top 10 medications that older adults should not take or should take with extreme caution. But again, if your only two tools are to give a pain reliever and a muscle relaxant, that's what will happen. And so they get these medications, and Scalaxin can cause falls and sedation that then leaves a patient at risk of serious injury in addition to whatever took them to the medical doctor in the first place. So it's a really slippery slope. And we certainly use too many medications in the U.S. I think you use less in Canada, but still far too many, as individuals do. And older adults consume, maybe 80% of the medications in society. So that's the population that's most at risk, and it's the population that has the least ability to metabolize medicine safely. Most older adults are dehydrated a little bit. They don't drink enough fluid. These medications are designed to be diluted with fluids, and if you don't drink enough water, you're going to have a high concentration and perhaps a toxicity. They're also designed to go through the digestive tract in a day or two. In older adults, they're slower. Their gastrointestinal tract is slower, so the drug may stay around for a longer time. There's many, and older adults have higher fat mass and less muscle, so the drugs are meant to be metabolized in the muscle, and so older adults can have a drug toxicity issue much easier than a younger person who has more muscle mass, more fluid in their system, and just a body that's digesting things more quickly. So older adults have many reasons that medications are risky. And so some new research that's coming out say that if people go to a chiropractor first, they're less likely to have an adverse event of drugs. They're less likely to die from or become opioid addicted and die. So chiropractic is saving lives quietly in the background. And I think it's an important thing, and more studies will be done on this since opioids are such a particular public health challenge.
Thank you for that. Yes, that's a caution that seniors, it's good that seniors are aware of that medication, especially opioids, that is not the best route to go. Okay, so as we grow, as we get older, we experience changes. Certain things don't function as well as did before. And the changes that we undergo would, in some respects, make diagnosis more challenging for a physician, for a chiropractor. What are the best practices in your profession, and what should a senior who is going to a chiropractor expect in terms of accommodating the changes that a senior would be experiencing?
Very good question, and an important one. Senior citizens or older adults are not just older, young adults. They have a different physiology, they have different anatomical changes, and so it's important that people be trained in the care of the older adult patient. So some of the changes that occur as we age are a loss of bone density. That's going to change how it's safe to adjust. So what methods would be appropriate for doing spinal manipulative therapy on an older adult? We have less muscle mass, so we don't have as much muscle along our spine, so we don't need to use as much force in adjusting an older adult patient. So chiropractors have to keep these things in mind and then alter their adjusting strategies or their chiropractic strategies in caring for and doing spinal manipulation on older adults and other joint manipulation on older adults. So those are some simple things. Also, too, in general, there's many other changes that are happening for older adults. In fact, most older adults will have one or two or more chronic conditions that go along with their musculoskeletal pain. So they may have heart disease, they may also have diabetes, so they may also have arthritis. So they may have several things that are complicated, and then that requires that, according to the best practices article, and just our common sense as clinicians, whether we be a medical doctor or a chiropractor, we have to do a very, very thorough history on the patient. Make sure that the patient also, too, is cognitively able to advocate for themselves and to remember what is happening with them. So some people that have some dementia may want to bring in a family member so that they can point out, maybe help fill in some of the gaps where an older adult that has some cognitive loss might need a little help. But also, too, just then beyond just the good history, to do a thorough and complete physical examination and a good medication, develop a good medication list. If the patient doesn't have their own medication list written out that they have with them or in their phone or however they carry it, they need to have one developed for them so that that all providers that see them know all of the medications that they possess and take, even if occasionally, because drug interactions are the principal drug safety issue in both of our nations. So, polypharmacy, too many meds or the wrong kind of meds is a problem. So to take a good history about their health, a good physical examination, a good medication history, and then also, too, in older adults, it's not just the physical health that has to be assessed. We need to do a functional assessment to see how well the patient gets up and gets around and how well they're completing their activities of daily living, to ask about, are you able to get dressed by yourself? Are you able to get up from the toilet yourself, to take a shower and bathe by yourself, go drive to go get groceries? All of those things are important questions to ask about. And then as well to do a simple cognitive assessment on the patients, just to get a baseline, because you'll never know if there's a change unless you have a good baseline. So the first visits should have some baseline examinations of that. And the last part of that is also to do a home safety checklist, to send something home that the patient can do a checklist through their house to make sure they don't have any hazards that might cause falls or injuries at home. And a family member or friend can be very helpful in going through that with them. It's very fun to go be the detective and find things that could potentially be cause injuries and then rectify those problems in the home. And then the last part is to do an oral health assessment. And I know Yes, we are chiropractors, but all health professionals that are at the physician level should be looking in the mouths of their patients to, in between those visits of the dentist, maybe once a year or once every 6 months, somebody should be watching for any gum sores or any problems with teeth that need to get referred to a dentist, or if it looks like cancer, to somebody to check it for oral cancers, because the risks of cancers, the risk of tooth loss, the risk of gum disease is higher in older adults as well. So that's just part of the general battery of tests that's considered the gold standard for care of older adult patients.
Pretty interesting, because my next question is that concerns the spinal manipulation, and when most people think of the chiropractor, that's all that they think of. But from what you said, it's a whole lot more. It's a whole lot more. But let's look at spinal manipulation. Exactly what is that, and how is it used?
For me to describe and gesture wildly is not going to be helpful, but I do have a spine. And so I don't have a patient here laying on my desk, but since I'm not in the clinical setting today, I'm in my office. I wanted to just point out that maybe people have seen models of the spine, and if not, this is typical of anatomy. This is the head end, and this is the tail end of a person, and these are our hips and pelvis. But old traditional chiropractic adjustments that are taught everywhere, by the way, are place their hands on the patient, and in the case of an older adult, all you need is really thumb pressure. You don't need your whole hands, but thumb pressure to do on a vertebra that we've found has some pain or is out of position, to go ahead and do a little manual thrust. So a little thrust. In younger patients, we might use our whole hands and need that amount of force, but with an older adult, we can get away with way less force. So those are traditional methods, and that's methods that are taught in virtually all chiropractic colleges around the world. The 16 or 18 that are in North America, and then the other 20 some that are in the other parts of the world. 20 or 30 other schools. There's a lot. But there's some different techniques that are specifically for older adults, and that are, I would say they weren't designed for older adults, but as it turns out, they're very, very effective in older adults. And the most common that's used in the profession, aside from that manual type of hands-on adjustment, is adjustment with an instrument. This is particularly called an activator instrument. Activator instrument was the first FDA-approved instrument for spinal manipulative therapy, and it has dozens of controlled clinical trials for efficacy. And certainly, this can allow you to turn the instrument way down to a lower force and position the instrument on whatever vertebra needs to be adjusted and do a simple thrust, and it gives a measured thrust that's always consistent and is shallow enough to be very safe for any part of the spine in an older adult patient. And again, since you have the force numbers here, you can turn it down to the lowest setting for an older adult and be ensured of a very safe manipulation in there, and it's effective as well, even in the hips. And we use a little higher force in the hips, but we could adjust a hip bone or a femur or a knee or a hip or arm or shoulder, and or a wrist or a hand or a thumb or anywhere else, because this instrument has a small head. It's very easy to get into some of the smaller bones and do a very safe, very measured adjustment. And I am an instructor in this technique and have advanced training to get that. So if people want to ask for that by name, they would look for a doctor that has activator methods training if they wish to have that. And that would mean that they wouldn't be twisted, their neck wouldn't be twisted, they wouldn't be laid on their side and have that old school, kind of popping of the bones. Some people love the popping of the bones, but some people don't prefer it. So that's an alternative. And then another technique uses padded wedges that are placed under the pelvis of the patient in various positions to unwind a hip that may have gotten rotation in it that causes them pain, because everybody has a hip, right? That's an issue. So that just uses the patient's weight and gravity over time. So you can imagine that's a super safe adjustment strategy for older adults to help with their pelvis and low back problems. And once you correct this, a lot of things resolve all the way up the spine. So that's a nice thing. There are also, by the way, I think I may have mentioned earlier, there's like 250 named chiropractic techniques that people can get training in. And one other popular one with older adults I'm a big fan of is called flexion distraction. And it takes it has a special table that the patient lies on that has a piece in the middle that then flexes. So the patient's lower body can be here and their lumbar spine is here, their low back, and it stretches and can bend and rotate and allow movement in areas of the spine that maybe the older adult has not had movement in for some time. And it's very gentle, measured movement. It's not, they don't really pull or traction you out or hang you on a rack or anything like that. But that gentle movement in the spine is very, very helpful for patients that have stiffness as a chief complaint, which is a very common complaint in older adults. And that would be looking for a patient that, or a doctor, that uses flexion distraction if they wish that type of technique. So there's just a lot of techniques and different strategies that use very gentle, very low force maneuvers to do the chiropractic adjustment. And I think older adults, if they knew that, if somebody is just going to put the pressure of their finger on their spine, it's not scary, it's not dangerous, there's no popping, there's no cracking, there's infinitesimally small risk. So it would be a great introduction to chiropractic. And so I always tell my students, we start with the least invasive thing, which would be a low force thing with older adults. And then if you get clinical benefit with that, then stay there. Why would you move to any other more aggressive maneuvers? You don't need to. So that's my philosophy of care, and it's not everyone. So people should shop a little bit for their doctor of chiropractic and find something that works for them.
It's interesting to see the instrument on a bare spine. And yes, the hip bones, so we can use our imagination on what it would be on a person. So who is the best candidate for chiropractic care? Who should be coming to a chiropractor?
Well, certainly, if it were me and I was just saying to people that I love, I would say everybody could benefit in some way from having a check, just like I think everybody benefits from getting a dental checkup. I think everybody benefits from getting a spinal checkup to see if there's anything that can be improved. But particularly the ones that it's crucial that they get care are people that have musculoskeletal pain. We have good sound evidence, a strong evidence base. We have, our techniques have had 125 years of development and a profession that has had good staying power because we've been so popular with our patients and done so well in caring for patients. So people that are struggling with pain shouldn't be struggling with pain. And that's from any age. But certainly since older adults bear the weight of having the most musculoskeletal pain, they're excellent candidates for chiropractic care. And I think that it's a shame when they suffer in pain and don't get chiropractic care. Might I share just something that happened in my first week of practice when I was practicing in California? So we had an office that exclusively used low force techniques. So we had a niche, or a niche. People came to us maybe because they were scared of other types of chiropractic, or they just were creeped out by a popping sound in their spine. Whatever their reason, they came. We got a lot of older adults, and we got a lot of children, and we got a lot of people who were very severely injured or in severe pain, and they knew they didn't want to take any risk, right? So one of those first patients I saw in my first week of practice was an older woman who, God love her, she must have been close to 80. And she was, they were retired. Her husband had worked quite late in his life, till in his upper 70s, and he wanted to now go travel. And he wanted his wife to go, but she was in disabling back pain. She couldn't have thought of getting in a car or getting in a recreational vehicle of any sort, one of those big things that they drive around. I don't even know the name of them, but she couldn't have thought of sitting for 8 hours. She wouldn't have enjoyed it. She would have been in so much pain. She couldn't have looked around. She would have just had to put her head down and take a lot of meds to survive that trip. So she said, I think it's not fair for my husband that I be, holding him back. He wants to travel and I want to travel with him. So that was her goal for care, was to feel better enough that she could go along and sit in the car and go see the country. And so I did nothing but, a good evaluation on her, laid her down on the table and used the instrument assisted adjusting, very, very minimally force. And as I was raising her up, she was crying. And I thought, oh no, I've injured her. I had a good run. I got to practice for a whole week. That was nice, but it's over for me. I was so sad because I thought I had hurt her. And I said, why are you crying? And she said, I have been suffering in such pain for so long. And here in 10 minutes, 15 minutes, you have reduced this pain so significantly. She said, I know I'm going to be able to do what I want to do in traveling with my husband. And she came in a few times and they went off on their journeys and she had a wonderful time, but it gave her life back. Not me, but chiropractic care gave her life back. And I've also had that similar experience with my own mother, who's now 91 and a half. You can count the halves when you're 91. And she called me while I'm at work and said, is your shingle out? Meaning, have you hung out your shingle to work today as a chiropractor? And I said, well, not officially, because I would have to go home to care for you. She said, well, I really need care. And my mom never has pain. She is a tough old German woman. She never experiences pain. And if she did, she wouldn't tell anybody about it. But that day she needed help. And so I went and left work and I cared for her. And again, I just adjusted her, very low force. And as she walked in for me to care for her, I saw her bent over. And it was the first time I ever saw my mom as old. Now, understand, this is a woman who had white hair since she was in her 50s. So she always looked old to everybody else. But to me, she was so spry and riding roller coasters and riding bikes and going out and doing crazy things and whitewater rafting. So I never thought of her as old until that day. She was bent and she couldn't stand up straight. I just adjusted her the same way that I had adjusted the other patient that I mentioned. And she got off the table and she said, I'm all better. She said, I always get mad at those old men. They're walking around all bent over. And I think, why don't they just stand up? It's because they're in pain. She finally had empathy for the first time in her life for people that were older. And she said, if only they would just go to the chiropractor. They don't need to be suffering. And I was like, just shout it to the world, Mom. Just shout it to the world. People need to not suffer. There's no reason people should be suffering. And it's just these patients, especially the older ones, that they don't have high expectations. They just want to get a little bit better. And sometimes they get completely better, with just a visit or two. And it's just so incredibly gratifying because they don't come in with terribly high expectations, but sometimes you just exceed them hugely. And they're so grateful, and they just tell all of their family and friends, and then we get to care for the whole family. So they're our best patients, in my humble opinion.
Those are wonderful stories. Really, really a big change for both of those. Now, I want to look at prescriptions. So when you go to a medical doctor and you take away a prescription, it's a bunch of pills that you've got to pop. But when you go to a chiropractor, you get a different type of prescription. Tell us a bit more about that. There's a concept of exercise as medicine.
Absolutely. Medications are outside of the scope for chiropractors. So we do not do drugs or surgery. We do not prescribe medications and we do not do surgery. That's by choice, out of our scope. We were the profession that was the drug-free profession that wants to try to find the cause of the disease and find the cause of the problem and address that. So that's part of our chiropractic philosophy, to do the least invasive rather than the most invasive care, including spinal manipulation when necessary. But there's also things that patients can do on their own, self-care things. So our prescriptions, 95 or more % of chiropractors in the field talk to patients about specific activities or physical activities or exercises that might help to strengthen their spine or might help to prevent back pain down the line, because we know all too well that spines like this one laying here don't come like this. They come with muscles attached everywhere. And when you have muscular issues that you can't effectively resolve the problem in the spine. So we need to also talk to patients about ways to strengthen the core that supports the spine. So my son has made a very good living as a chiropractor out of mostly showing patients how to move without hurting themselves, showing patients how to do their activities of daily living in ways that strengthen their muscles, not put strain on their back and harm. So we may prescribe specific strengthening exercises for areas of the core body, the area around our spine here, or for out in the extremities, or teach patients about ways to walk in a way using different muscles and help them understand that some of the weaknesses that they have are causing some of their pain. So we do prescribe exercise, and exercise in general as well. Physical activity is the number one recommendation that will improve the health of an older adult patient. Did you, in this country, and I think it's quite similar in Canada when I've looked at the studies, about a third of men and about half of older women over age 65 get no measurable physical activity, none. And this is what causes us to lose our muscle mass and then to fall and then to have injuries that we're recovering from. And that's no way to live, always digging out of the hole of an injury and trying to recover from an injury. So yes, prescribing physical activity is often something chiropractors do. And in addition to that as well, in many states, and I don't know about what the rules are in Canada, but in many states in the United States, most states, in fact, chiropractors can talk to patients about their diet, or they can talk to patients about maybe nutritional supplements that may be helpful to support healthy bone mass or healthy muscular system. So we may also talk to patients about an herbal remedy like glucosamine or chondroitin for joint health, where there's evidence to support it, or a nutritional supplement like vitamin D to make sure that they're getting enough vitamin D, since in Canada and my part of the United States, people can't get sun about 8 months of the year. They end up with vitamin D deficiency, which harms their bony structures. So we may talk to patients about getting adequate vitamin D or other things that are supportive of a healthy musculoskeletal system. So that's another thing that chiropractors do. And I would just say we're doing a lot of health promotion and prevention, a lot of preventive things like that in chiropractic practice that helps to reduce the burden on the healthcare systems of Canada and the United States for those urgent care things that happen after a patient has not done those preventive things for many years. So we do have a great role to play for preventing chronic diseases in helping with having a healthy diet, good exercise, and supplements where needed. So that's something that chiropractors often do.
Yes, you're on the side of wellness.
Absolutely.
Yes.
Who
So,
wouldn't be?
now, what would you say to those who have the impression that once you go to a chiropractor, that's it, you have to go every time you know, so you start, and once you go, you just have to keep going back. What would you say?
I went to a dentist once when I was little, and then I had to keep going back. It's weird, isn't it? How dare those dentists be so dishonest and make me keep coming back? Because it's important to take care of your health, or oral health and also spinal health. I am an advocate of patients checking in every once in a while, but I know in your country and in the college that I have visited in your country, they have a little bit more hands-off approach, encouraging patients to only go when they're in pain. If they just do that, they'll still get help. And it may not be one, like you develop a problem over the last 50 years, you go see a chiropractor and they're going to wave a magic wand, push a few bones, and magically you're going to be completely healed. It's a actual strategy to help resituate bones in the spine and the muscular system, and to get that all to be functioning correct sometimes takes a series of visits, which shouldn't surprise anyone. I think that people can't think that I went to a massage, therefore I'll never have a problem with my muscles ever again in my life. I went to a massage one time. And so it's not a negative, but we do want to implement a program that's going to help people to not only be out of their immediate and urgent pain, but also to be supportive enough that they're going to stay out of that trouble, to empower patients with their own activities and with thorough assessment of the gait and functional systems, to make sure that we know what we can do to advise them to prevent injuries in the future and prevent that pain from becoming chronic. So we do try to stay in a relationship with our patients to be their musculoskeletal specialists throughout their lives. And there's nothing to apologize about that at all.
The final thing I had on my list here was when someone, let's say a senior, has understood fully and is ready to go the route of seeing a chiropractor, what considerations what are some of the things they should consider when choosing a chiropractor?
Since chiropractic is such an intimate health professional, just like a massage therapist would be they're going to touch your body. Chiropractors touch your body. And so it's something that you're going to have to find the person that's right for you. I think that the best resource for that information may be friends and family who have had experiences that have been positive. So if the family has a good trust and has had a good positive outcome and experience with that person, they would then be a good person to try for chiropractic. But I also think to avoid the chiropractor that just doesn't do many of those other things about trying to prevent injuries. They just crack the patient, crack the bones, let them go, and then they want you to come back a million times. I would steer clear of that, and that's super old school. But honestly, I feel in our profession we should want to practice in a way as if we're trying to put ourselves out of business. We want to get a patient back to work, back to play, back to fun, back to lifting their grandkids as quickly as possible, and then leave it to the patient to when they want to be seen again. And those chiropractors are my favorites. So I would maybe ask questions of the chiropractor about that frequency of visits and about what their goals are and what kind of strategies do they use to prevent the injury or the problem from reoccurring, and just listen. And I think people in talking to a doctor can get a feel for their value sets and see if it's congruous with your value set as a patient. Some people want to just be like, I'm going to go in, I'm going to get one adjustment, I'm not going to go back ever, and that's their right. And they need someone with really good skills, of course. So find somebody that they have had a referral from friends or family that is high, or the community that has been either highly recognized or applauded for their good skills and their good reputation, and then choose that chiropractor and give them a try. But to not think that it is all one size fits all, right? There are chiropractors that only do manual care, because maybe that's all they've been trained in. There are chiropractors that only use an instrument, but that maybe that's not something that people would choose. So that you have to find what is best for you. Because people have different opinions of what they like and enjoy, and they may have to try a type or two of chiropractic care before they find what is best for them.
Wonderful. Thank you so much for that. Those were all of the points that I had to cover. Is there anything that we haven't touched that you'd like to close off on as we round up?
I think it's okay for an older adult to specifically ask, do you have any training and techniques that would be lower force? That way they can see that the chiropractor has put some extra dedicated time into having a strategy that's different and specific to the needs of the older adult patient. I think that's a fair question to ask, and I just want everyone to talk to people, find out what their friends' experiences have been, and if it's the good, the bad, and the ugly, they'll find it all out with conversations, and then they can choose what they need. And certainly to have people not suffer. There's no reason to suffer in this life. Life's too short. Enjoy. right?
Indeed, life is meant to be enjoyed. Thank you so much, Lisa. I truly appreciate all that you've shared and the time that you've spent to help seniors understand about the profession and what help, what relief they can find by going to a chiropractor. Thank you once again.
You're very, very welcome. Bye, everybody.
It was a pleasure and a privilege to speak with Dr. Lisa Killinger on the subject of chiropractic care so that you can take a look at it more closely and see whether it is the right path for you to deal with the aches and pains of growing older. Thank you so much for joining us on this episode of the Golden Years Fireside Chat series. I am Celia Sanka, Executive Director of the DiversityCanada Foundation. We are the organization that brings you GoldenVoices.com. That's the website where you'll find this and other episodes of the Golden Years Fireside Chat series. Until next time, take good care of yourself and join us for another episode in the Golden Years Fireside Chat series where we will look at living longer and living well. Take care. Bye for now.